Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to general medicine, folate deficiency anemia. Before going to topic outline, if you want to watch the same topic, same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now today our topic is folate deficiency anemia. In topic outline, today we will study definition, causes, pathophysiology, clinical features, investigation and management. Like in previous videos, when we studied classification of anemia, we place three types of anemia in macrocytic anemia classification. Number one is vitamin B12 deficiency anemia. Number two, pernicious anemia. Number three, folate deficiency anemia. And number four, hemolytic anemia. In previous videos, we studied vitamin B12 deficiency anemia. We studied pernicious anemia, but today we will study folate deficiency anemia. First, start from definition. A macrocytic anemia due to folic acid or vitamin B9 deficiency is called folate deficiency anemia. In definition, folate deficiency anemia, first is it is macrocytic anemia. Number two, it is occurred due to deficiency of folic acid, main vitamin B9. A macrocytic anemia due to folic acid vitamin B9 deficiency is called folate deficiency anemia. Now come to causes. There are 6 causes of folate deficiency anemia. Number one is prolonged cooking. If we cook too much vegetable, in the result there will be damage to folic acid. This is the first cause of folate deficiency anemia. Second cause is chronic alcoholics. If a person take alcohol for long period of time, in result there will be folate deficiency anemia. The third cause is pregnancy. In pregnancy, the requirement of folic acid will be increased. Number fourth cause is lactation. In lactation also the requirement of folic acid is increased. Number 5 cause is intestinal malabsorption like celiac disease. When from intestine to the blood the folic acid absorption is not occur, in the result there will be folate deficiency anemia. Number 6 cause is if there is a long-term treatment of medication like anticonvulsant, oral contraceptives, methotrexate, they also cause folate deficiency anemia. If this certain medication used for long period of time, therefore this medication is known as anti-folate drugs. Number 6 cause is chronic hemolytic anemia. Chronic hemolytic anemia also cause folate deficiency anemia. These are the 6 causes of folate deficiency anemia. Now come to the pathophysiology. In pathophysiology, when there is folate deficiency, in the result there will be inhibit DNA synthesis of erythroblast. When DNA synthesis of erythroblast occur, in the result there will be not nucleus maturation of erythroblast. And the erythroblast which nucleus is not mature due to DNA synthesis inhibition, this erythroblast change into megaloblast, large size cell, and megaloblast without maturation die before maturation. Because megaloblast nucleus is not mature, this megaloblast die before maturation, in the result there will be anemia. In pathophysiology, number 1, folate deficiency. Due to folate deficiency, inhibit DNA synthesis of RBC. In result, there will be In result, nucleus maturation not occur of erythroblast, and erythroblast change into megaloblast, and megaloblast die before maturation. In result, there will be anemia. Now come to clinical feature. There are 7 clinical features of folate deficiency anemia. Number one and 2 is specific, other is same like other anemia. Number 1 is glossitis, mean inflammation of tongue. This is present in glossitis is present in vitamin B12 deficiency anemia and folate deficiency anemia. Number 2 is sore mouth. In vitamin B12, in place of sore mouth in vitamin B12, there will be angular stomatitis. But in folate deficiency anemia, there will be sore mouth. Number 3rd clinical feature is fatigue, and number 4th is breathlessness. Number 5th is tachycardia, and number 6th is headache, and number 7 is pale skin. After clinical feature, come to investigation. We basically do 2 investigation for folate deficiency anemia. Number 1 is CBC, which show macrocytic anemia. Mean corpuscular volume, MCV, is greater than 95 micron. Number 2nd investigation is folate level. When we do folate level of patient, if there will be less folate level, it shows folate deficiency anemia. These are the 2 investigation for folate deficiency anemia. Now come to the management. In management, we do 2 things. Number 1, remove cause. Like if a person take alcohol, they should leave alcohol. If a person take long-term treatment of medication like anticonvulsant, oral contraceptives, methotrexate, they should replace the drug or inhibit the treatment. Number 2, in management number 2, we give oral supplement of folate to patient. Now today we studied folate deficiency anemia definition, causes, pathophysiology, clinical feature, investigation and management. Now our topic is complete. If you like my videos, press the like button and share my video with your friends. And if you are new to my channel, subscribe my channel for more videos and press the bell icon to open the all notification in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.